Let loose with a nail gun at work, Butterfingers got the better of him.
I got around to putting the beads on one of my timber doors that I was glazing, and I was just nailing the beads to the door, and the nail gun slipped, and I shot my finger.
Nailing bone instead of beads is bad enough, but Michael's gun has gone one better.
At the moment it's just throbbing, but I can't bend my finger because that's right in my knuckle.
Dr. Shaw has seen her fair share of young men impaled on nails, but the case of Michael's unbending finger has intriguing features.
Fairly fine nail gun as nail guns go.
Yeah.
It's fairly rigid, isn't it? Has anyone x-rayed it?
No.
No.
The stiffness of Michael's finger suggests the nail may have entered and jammed the joint, making it too risky for Dr. Shaw to take out herself, but come out it must.
The worst case scenario would be that it became infected and comes to amputation.
The x-rays show that happily surgery won't be necessary, but the case is more complex than at first it seemed.
You can see that the nail doesn't appear to go into the joint, and I think the reason he can't bend is probably because he's caught the tendon that comes up from the forearm and straightens up the finger. And obviously, in order to be able to bend, that has to stretch a little. So I think if we take the nail out, that hopefully he'll then be able to bend. This is your hand, okay?
Sensitive to his finer feelings, Dr. Shaw gently talks her patient through her preferred procedure.
Hopefully, if we just get hold of that with a good pair of pliers, that will now just pull out if we're rough enough.
I can't wait to bend my finger again.
The anaesthetic will make sure that Michael won't feel the doctor yanking his nail.
There we go. We'll give that about 5 or 10 minutes for that to work.
5 or 10 minutes? That's a long time in the life of a man like Michael, who has a hectic schedule to stick to.
I just can't wait to get it out so I can go back to work again and have my lunch.
We've got some pliers on here so we can get a good firm grip on it.
Dr. Shaw's tools look as though they came from her garden shed, and her patient is looking, well, mildly terrified. A lifetime of experience has helped Dr. Shaw master this complicated technique.
Oh, dear me. Right. That's it. It's out. Can you bend now? You can. Excellent.
The doctor gives the digit a good old wash to prevent infection.
Weird, because I knew it was there, but I just couldn't feel it or feel it being pulled out or anything, so I can bend it all again, which I'm happy about.
There's just one thing left to do.
Present for you.
I'll put it back in my door where it belongs, instead of in my finger.
At last, Michael Wright's wrongs are well and truly behind him.